So, Dr. Laura Haynes, it's a pleasure to meet you.
Pleasure to meet you.
So, Dr. Laura Haynes, you are a general board member for the IFTCC. You are a retired psychologist with 40 years of clinical experience, and you have served as an expert on sexuality and gender research for professional organisations, members of parliament, other legislators, courts, UN delegates, and high-level government officials. So, what are some recent research findings that you think are important for us to refer to as we advocate for biblical sexuality and gender?
I think the most exciting research findings that are in recent years have to do with the belief that same-sex sexuality or gender identity are inborn or can't change. And that they're not true. We know now that they are not true from research. It's a sensitive question because many people came to terms with their same-sex sexuality or incongruent gender identity through the view that they were born that way. And some came to terms with their same-sex sexuality or incongruent gender identity through the view they were not born that way and that it's not who they truly are. But the research comes down, the largest gene study and the largest twin study have shown us that the genetic contribution, biological contribution, is minor and that there are environmental contributions. And we also know from identical twin studies that the other biological environmental influences with gender influences do not entirely explain same-sex sexuality. So there are other influences. The American Psychological Association's APA Handbook of Sexuality and Psychology accepts that biological influences do not entirely explain same-sex sexuality. It says there are psychoanalytic causes, and that childhood sexual abuse may be a cause, is an associative and potentially causal link for some, based on research that includes a longitudinal 30-year study and a controlled study of documented cases of childhood sexual abuse. Now, on gender dysphoria, we have a global consensus statement from endocrine societies around the world has said the brains of gender incongruent people have not been found to be consistently to be different from the brains of gender congruent people. The evidence just doesn't add up consistently to that. And that they believe in a psychosocial biological model of gender identity. And the APA, the American Psychiatric Association's Diagnostic and Statistical Manual, also says there is insufficient evidence to support the view that gender identity dysphoria is an intersex condition of the brain. So there just isn't the evidence. It's been a strategic viewpoint that gender identity is biologically determined, but it's a viewpoint that has never been substantiated. And there are now studies that, it's well known as far as psychological matters or factors are concerned. It's well known. There are many studies in many nations showing a high association of high rates of psychiatric disorders, neurodevelopmental disabilities, suicidality, and self-injuring behavior with people who have incongruent gender identity. That's widely accepted. That's not controversial. Most of the studies can't tell us which came first, the psychiatric conditions or the gender dysphoria or incongruence. Some of them do, and of those, all agree the psychiatric conditions came first, before onset of gender dysphoria, therefore may be causes. And Finland's government recommendation says psychiatric disorders may predispose an adolescent to the onset of gender dysphoria, and the first-line treatment for gender dysphoria is treating psychiatric disorders. And Sweden and France are going, and the United Kingdom are moving towards psychotherapy, away from the medical treatments toward psychotherapy for treatment. So I think these are very, very important and exciting recent studies. And in addition, I must mention the leading study that has been used to claim that same-sex attraction cannot it can't, it's dangerous, it's harmful to have therapy to try to manage, reduce, or change same-sex attraction. And this is studies relied on by the American Psychological Association to oppose change-allowing therapy, and other organizations also follow the APA on this and this study. Well, the study was put together by the leading gay activists, researchers, including the originator of the minority stress theory. And out of this data set, we know that if you only look at lifetime suicidality among LGBT identified people, that is people who did not change, you only look at those who didn't change, were they harmed by the counseling, their lifetime rates of suicidality are higher than for people who did not have the counseling. But a further investigation of that data discovered most of that lifetime suicidality was before the counseling, not after.
Wow.
Therefore, the counseling was effective in reducing suicidality. In fact, 17 to 25 times lower for adults. So banning therapy is banning the cure. It's banning an aid to reducing suicidality. So those are very, very important studies, very helpful.
Wow, that's fascinating. Thank you very much. So what are some of the defining moments and successes that come to mind from your experience working with a vast array of professional organizations?
Well, I am working with a vast array of organizations, I think, because we have become well networked around the world. And of course, the IFTCC is certainly an example of that, with 27 nations here at our conference. But, you know, even as recently as 2018, we had a terrible attempt at a therapy ban bill in California that would have even told adults what they can and cannot do and talk about in therapy. Wow. And when we started out to deal with that, there were like 3 of us. And soon there were 7 of us. Well, within 6 months, we were organized across the United States. And now we're organized around the world. So we can share research and developments very quickly. And we're working together. Another development that I feel is very good is that we feel we're making advances in the court challenging therapy bans in the United States, and we're feeling very optimistic about that.
That's fantastic. And are there any particular successes that come to mind during your 40 years of work?
You know, one thing that it really strikes me is people who come for therapy, who have same-sex attraction, and changing it is not a goal of therapy. Maybe they have no religious or moral or personal or life reasons that would cause it to be a reason they want to change it. That's fine. So we just give them treatment for what they want treatment for. But as we follow the trail of their own pain and goals, it may lead to where it needs to go. And we may see same-sex attraction decrease and even fall away.
Wow.
And to me, that is stunning.
That truly is. So, what message would you bring to trainees at IFTCC Learning who desire to help many in the area of sexuality and gender?
Well, I would encourage them to learn the research. It's available on the IFTCC website. So I want them to, we want them to be well versed in that, and learn various approaches to the counseling, so they can find the approach that fits who they are and their way of working. But they should know more than one way, I think, to sort that for themselves, and that's available on the IFTCC website resources.
Okay, fantastic. Well, Dr. Laura Haynes, thank you very much for your time. It's been a pleasure to meet you.
A pleasure to be with you.